Good morning. I call this meeting of the Health Professions Subcommittee to order. If we will please take roll. And a quorum is present. Thank you, Madam Clerk. So first we have an administrative action. If I could entertain a motion to strike House Bill 1416 at this patron's request. It's been moved and properly seconded that we would strike House Bill 1416 from the docket. If the clerk will please open the rolls, this is a recorded vote. Okay. And that bill is stricken from the docket. Next, we will go to Delegate Glass, who has a few in front of us today. Delegate Glass, which one would you like to start with?
Actually, Madam Chair, I would like to start with, if we can, because I would ask administrative action on one, and I would like to say why. House Bill 576. Okay. So that is the Dietitian Compact. Interesting enough, the Commonwealth of Virginia, Madam Chair, doesn't have a dietitian licensure, which also was kind of shocking to me as well. In finding this out, what we're going to do is over the next year, spend some time with stakeholders and learn about how we can get ourselves on a pathway for something so important as we know that food is medicine. And then when that has some time to breathe, then maybe come back with a compact, not next year, maybe not even the year after that, but get us on a path where we can license this profession.
And so would you like for us
to strike the bill, if you may, Madam Chair?
And I would, side note, love for the Commission on Hunger to work with you on that, because that has come up several times. But I will entertain a motion to... It's been moved and properly seconded that we would strike House Bill 576. That's a recorded vote. Members, please cast your votes. And that bill is stricken from the docket. Delegate Glass.
Gratitude, Madam Chair. Can we take up House Bill 573, the breast implant patient decision checklist? Okay. So, Madam Chair, I think when people hear breast implants, they automatically think maybe like reality TV women or things like that. I don't know. There's certain things that come to mind. I, in 2013, lost almost all of my breast tissue after had this 2011. Yes, my daughter's almost 15. Lost almost all of my breast tissue after I stopped breastfeeding. I made the very difficult decision 2 years later to get breast implants. One, because I was really going depressed, quite frankly, feeling really unhappy about myself. But there was, in that moment, there's a lot to weigh when you choose to do a cosmetic surgery. I was very fortunate enough to be in a place where the doctor was prominent and went through everything from, I was in Florida actually, where they went through both the pros, the con, what's different between the synthetic or silicone and smooth. Like we went through it was a deep decision where they also addressed my mental state of mind making this decision, as well as the things I need to consider due to the surgery. Our ask here, and there is a substitute. I should have started there. There's a substitute because the original bill was just saying, hey, we'll make a checklist.
So before we do that, just because we've seen this bill before, Attorney Brooks, if you could report the substitute.
Copy.
Madam Chair, the substitute for HB 573, this directs the Board of Medicine to convene a work group to develop educational materials promoting best practices for patients considering breast implants, and it directs the Board of Medicine to distribute those materials to its licensees by January 1st, 2027.
Perfect. And I did hear a motion. Can I get a second? So the substitute has been moved and properly seconded. All those in favor, please say aye. Any opposed? So that substituted bill is now before us.
Gratitude, Madam Chair. And that substitute comes at the education of me from the Medical Society of Virginia, understanding that you got to have the right licensed professionals at the table to consider, especially something like this. So that's the hope, is that this work group can help with having the right educational materials in the Commonwealth for people deciding to go about breast implant surgery.
Are there any questions from the subcommittee? Seeing none, is there anyone here to speak in favor of House Bill 573? Is there anyone here to speak against House Bill 573? Seeing no one online, I come back before the subcommittee. Where's substitute? It's been moved and seconded to report with substitute House Bill 573. If the clerk will please open the rolls and members cast your votes. And that bill is recommended to be reported with substitute on a vote of 10-0. Delegate Glass.
The last bill that I have before you, Madam Chair, is House Bill 577. And that bill also has a substitute.
It's been moved and properly seconded that we adopt the substitute for House Bill 577. All those in favor, please say aye. Any opposed? That substitute is now before us.
Okay, I'll explain the substitute. We had to tweak some language. We got some information from the Virginia Department of State Police on how to manage these, the update to the compact on fingerprinting or a background check. So a couple years ago, I did a compact on social work. What happened is that the compact does require a criminal background check, and it was brought to the attention of the Board of Social Work that by the FBI, that the agency, FBI needs statutory authority to receive and maintain those records for social work. And that is why we had to amend the bill originally. Now, the additional language, which is the substitute portion, applies to all those professions, including it includes the other, like physical therapists, nursing compact. The nursing compact. It puts it in line for all the other professions that we have as well. I have. There is also the FBI determined that through a routine audit that Virginia didn't have some of the provisions that we needed in code, and that was only about 6 or 7 weeks ago that this was noted. I do have a representative here, but that's what this bill essentially does, is put us in a place where the FBI has a statutory framework to keep these background checks.
And with the substitute, I couldn't pull it up in time, that does keep it with fingerprints as well.
I believe so.
I know that issue had come up before, making sure that it is fingerprints and background check. Are there any questions from the subcommittee? Seeing none, is there anyone in the room to speak for House Bill 577? Please come forward.
Good morning, Madam Chair, members of the committee. My name is Ophelia Von Ludwig. I am a social worker, and I'm here to represent the Virginia Society for Clinical Social Work, and we do support this bill, and we thank you for your work.
Good morning, Madam Chair, members of the committee. Mark Smith, representing the Greater Washington Society of Clinical Social Work. The patron has done a nice job in presenting this. This was language that was brought to our attention after you all adopted the compact for social workers. And so it's more of a little bump in the road that we learned about after the fact. So appreciate your support on this.
Hi, my name is Annabelle Dreyer, and I'm a social work student at Christopher Newport University, and we would like to say that we are in support of this bill.
My name is Emma. I am also a social work student at Christopher Newport University, and I also support this bill.
Shout out seeing you. Anyone here to oppose the bill? And there is no one online for this. Delegate Glass, did you have anything further?
Yeah, Madam Chair, I did want to give Captain Gunderson, if she was in the space, the opportunity to sort of say if she was here. Oh, gratitude, you have to ask for it. Okay.
Thank you, Delegate Glass. Madam Chair, members of the committee, the reason why this is being brought forward kind of at a later time is we found out during our last FBI audit that the Virginia State Police was not in compliant with 19.2.389. That's the reason for the additional amendment, asking for those certain stipulations to be added and taken away within that statute to allow us to be able to provide you not only the Virginia criminal history, but also the national criminal history so that you receive the entire picture. As of right now, we only have until about March of next year. We've been given a grace period to become in compliance. So this will allow us to be fully compliant and provide the information that you need.
Thank you. Coming back to the subcommittee. The appropriate motion would be to report and refer with substitute. Second. It's been moved and properly seconded that we would report and refer to appropriations with substitute, House Bill 577. Members, please cast your votes. And that is recommended to be reported and referred with substitute to appropriations on a vote of 10-0.
Gratitude, Madam Chair and Subcommittee.
Thank you, Delegate Glass. Delegate Guzman. And you have House Bill 413?
Yes, Madam Chair.
Okay, tell us about your bill.
Sure. House Bill 413 aims to address the shortage of certified nursing assistants across the Commonwealth. So my bill will create a pathway for high schoolers to graduate with a certified nursing assistant license. Madam Chair, this will address not only the shortage across the Commonwealth, but I would like to share with you that also as a college student, I went to school as a mom, and this was a perfect side job, and I was not able to get my certified nursing assistant, but I did work as a home health aide on the weekends to make extra money to go to school. So this will also equip students once they get their license so they could make money while they are in school as well, Madam Chair. This will go perfectly along, and I would like to use this opportunity to thank Mr. Chairman for his leadership during the budget process to be able to provide money for a nursing path so students could get their degree. But this will be the first step for many students that if they are looking to stay on the nursing field, they could then become LPNs or RNs, Madam Chair, or nurse practitioners in the future. And I hope the subcommittee, support this bill. Thank you.
Coming to the subcommittee, Delegate Cherry.
Madam Chair, a question for the patron. It looks as though this does not create an unfunded mandate on any of the schools because it will only be operational if the state funds it. Am I correct in my reading of the FIS?
Madam Chair, what I would tell Delegate Cherry that currently the state provides funding to schools to specialty education programs, and this will be under the special education programs, Madam Chair.
Thank you, Madam Chair.
Any further questions from the subcommittee? Is there anyone here to speak in favor of House Bill 413? Please come forward.
Good morning, Madam Chair. Jared Calfee with AARP Virginia. We support the bill. Bolstering our long-term care workforce is one of the best things that we can do to ensure quality of care for residents of our long-term care facilities. As the delegate mentioned, we are working with Chairman Willett on a budget amendment to try and make a cost-free and barrier-free pathway to becoming a CNA. And so we think that doing this for high school students and putting this framework in place is an important piece of the puzzle as well. And I would also add that, someone could become a CNA coming out of high school, work as a CNA while pursuing more advanced nursing degrees as well, which is good for our overall health workforce. So we support the bill and thank the delegate for bringing it.
Anyone in opposition to House Bill 413? And seeing no one online, coming back to the subcommittee, and because it is state funded, it would need to go to appropriations.
I move to report and refer to appropriations.
It's been moved and properly seconded to report and refer House Bill 413 to appropriations. If the clerk will please open the rolls and members cast your votes. And that is recommended to be reported and referred on a vote of 10-0.
Thank you, Madam Chair,
Delegate.
members of the subcommittee.
We will now turn to bills from the subcommittee. Delegate McGuire. You have two before us.
Yes, Madam Chair, would you want me to do it here or up there? Okay, I'll do it here since we're all comfortable. We could start with HB 1522. And I do have a line amendment for that, and I'm happy to explain it. It really is just an amendment that will move the effective date back to July 1st, 2027. Move the amendment.
The line amendment has been moved and properly seconded. All those in favor, please say aye. Aye. Any opposed? So that is now amended.
Thank you, Madam Chair. Members of the subcommittee, HB 1522 would require all licensed nursing homes and assisted living facilities to have an AED on site and to have staff trained on its use, and would make their license approval or renewal dependent on an AED being present. This was actually recommended to me by a constituent who I have a letter from, who unfortunately found out the hard way that this is not our current requirement for these facilities. Many nursing homes and assisted facilities do have them, so we don't think there's going to be a major compliance issue, and at least 7 states currently require them, including Alabama, Florida, Massachusetts, Pennsylvania, and Texas. Virginia already requires AEDs in gyms, health clubs, jails, some dental offices, and public schools. So I think this is a good path down to get another requirement on the books. And I'll just really quickly read the letter that my constituent sent me this week that he said was fine to share. He said, on June 18, 2022, my mother lost her life at a skilled nursing facility in Alexandria, Virginia due to congestive heart failure. This facility conducted CPR and much later called the city of Alexandria EMT services, but did not use an automated external defibrillator to shock the heart in an effort to bring back a heart rhythm because they did not have one. After conversing with the skilled nursing facility management, BDH, and Medicare, it was determined by medical code that a skilled nursing facility, nursing homes are not required to have AEDs on site. And so this is obviously something that has had an impact on not only my constituent, but maybe others. And so that's why I brought it forward today. So I appreciate the consideration.
Thank you, Delegate. Coming to the subcommittee, are there any questions? Seeing none, is there anyone here to speak in favor of House Bill 1522?
Good morning, Madam Chairman, members of the committee. I'm Scott Johnson speaking on behalf of the Virginia Healthcare Association and the Virginia Center for Assisted Living. I want to thank the delegate for working with us on this. We surveyed the vast majority of member nursing facilities and assisted living facilities do have AEDs, which is a good thing. We support that. Also, I would let you know that the CPR training has a module or a component that requires training on AEDs. And so by the delayed effective date, your CPR training's got to be renewed every 2 years. That lets us link this up to the training. So again, we thank you and ask you to look favorably upon this.
Is there anyone here to speak against House Bill 1522? And there's no one online. Coming back to the subcommittee, are there any questions, comments, or motions? It'd be a report.
Move to report
as amended.
As amended.
It's been moved and properly seconded to report as amended, House Bill 1522. If the clerk will please open the rolls and members cast your votes. And that is recommended to be reported with amendments on a vote of 9-1. Delegate McGuire.
Thank you, Madam Chair. My next bill is HB 1523, and I actually just got an amendment to this that I have not been able to send to DLS or Chandler or anybody, so I'm happy to try to explain it. It's just a technical amendment that I'm fine with, or we could do it in full committee if we get that far.
So let's move forward with without it, knowing that it's coming, and that way we'll give the attorney plenty of time to do it before full.
Great, thank you. Madam Chair, members of the subcommittee, HB 1523 is about taking a proven public health tool Virginia already uses and applying it to gun violence. HB 1523 creates a voluntary certification for violence prevention professionals modeled directly on the community health worker certification that the Commonwealth passed in 2020. That law strengthened quality, professionalized the workforce, and unlocked sustainable funding with minimal administrative cost. Gun violence costs Virginia millions every year, and it's overwhelmingly preventable. Programs like hospital-based violence intervention are already working here, serving over 8,000 victims, cutting the re-injury rates to about 3%, and saving the Commonwealth tens of millions in healthcare costs. What's unfortunately missing is consistency and workforce stability. This bill sets basic standards, recognizes these workers as professionals, and positions Virginia to scale what's already working without creating a new bureaucracy or mandate. It's practical, fiscally responsible to help treat gun violence like the public health crisis it is, and reduce crime in the highest impact areas and save taxpayer dollars. And with that, I would ask the subcommittee for a favorable recommendation.
Are there any questions from the subcommittee? And just remembering that we will have that amendment coming in full. Is there anyone here to speak in favor of House Bill 1523? Please come forward.
Good morning, Madam Chair, members of the committee. My name is David Mills. I'm here representing Giffords, the gun violence prevention organization founded by Congresswoman Gabby Giffords and Senator Mark Kelly. We strongly support this legislation. Giffords has a distinction among the gun violence prevention organizations in the country in focusing on community violence intervention. And I believe we have our policy director from the Center for Violence Intervention under Giffords, Mike McLively, online this morning to answer any further questions that the committee may have. We thank the patron for partnering with us and working on this legislation.
Good morning, Madam Chair, members of the committee. Dominique Martin, New Virginia Majority, and a member of the Virginia Community Violence Coalition. I'm also in support of the bill for the reasons stated by the patron.
Thank you. Is there anyone here to speak against House Bill 1523? Seeing none, we will go online. Mike McLively.
Yeah, good morning from California. This is Mike McLively. I'm the policy director of the Giffords Center for Violence Intervention. I just want to thank Delegate McGuire for bringing this bill to the committee. It's incredibly important, and those who have already spoken have done a great job underscoring that Virginia faces a public health crisis like the rest of the country does with gun violence. And this bill would just create a certification process for violence prevention professionals. There was a JLARC report released about a month ago. If you haven't seen that, it really makes a strong case for the impact of community violence in the Commonwealth. And the fact that violence is concentrated, 9 cities are responsible for 50% of violence. And in those communities, we're starting to build up more and more of a violence intervention workforce. And this bill will help professionalize that and bring standardization and quality to the field. I'm also here on behalf of the Virginia Community Violence Coalition, which has dozens of organizations around the Commonwealth that are doing this work on the ground, city leaders, researchers, all of whom want to see this happen. And I'll just underscore, this is work that requires funding to get done, and this bill is a first step towards allowing reimbursement through Medicaid for violence prevention services. So this is a workforce just like community health workers that is growing and incredibly important to reducing violence. And in 2020, Virginia passed a bill to certify community health workers, and since then, hundreds have done that and have been serving thousands of folks across Virginia in the community health worker space. So just like that, we'd like to see the same thing happen with violence prevention professionals. This is a profession that is both an art and a science, and we want to make sure that it's being done at the highest quality in Virginia. This is a really important way of addressing gun violence, and we urge you to pass this bill. Thank you very much.
Thank you so much. Coming back to the subcommittee, before that, I just want to say I carried the budget amendment trying to get this covered by Medicaid, and so I know we have quite some work to do, but very thankful for your work on getting us there. Delegate Griffin.
Madam Chair, speaking to the bill when appropriate.
This is the appropriate time.
I'm obviously going to have to vote no against this. This is politicians giving us lectures on gun violence. We put forward that Charlie Kirk memorial about 6 months ago where we were opposing gun violence after Charlie Kirk was murdered with somebody who had a firearm. And half of our colleagues in the House would not stand up for the resolution, or they walked off the floor. A couple weeks ago, we stood up for the lives of the unborn, and I begged for the murder of babies to stop, and I begged our colleagues to join us in that effort.
Delegate Griffin, we
Yes,
are
Madam
talking
Chair.
about House Bill 1523.
Madam Chair, I know you don't want to talk about it.
Delegate Griffin, I'm asking you very nicely to keep your comments to House Bill 1523.
Madam Chair, I will
The
never
floor
stop
is
standing for the
floor.
unborn. I will not stop
Delegate
standing
Griffin,
for the unborn.
We are at ease. I'm in place. We are talking about House Bill 1523. Delegate Griffin, if you have a comment based on that bill, you may finish.
Madam Chair, I will not allow politicians to lecture us about gun violence. We will continue to stand for Second Amendment rights. It's arrogant, I think, when politicians come in and after some of the stances that they've taken that I mentioned, that they would come in and pass a bill like this. It clearly oversteps. It's clearly a jab at the Second Amendment, and I will not stop standing up for what's right. I want you to hear that, Ms. Chairwoman. Thank you.
Is there anyone else that would like to talk about this voluntary program for certified violence prevention professionals? Seeing none, is there a motion?
Second.
It's been moved and properly seconded to report House Bill 1523, knowing that an amendment is coming. If the clerk will please open the rolls and members cast your votes. And that is recommended to be reported on a vote of 7-2. Thank you. And we have been joined by Delegate Walker, and you have House Bill 1026.
Thank you, Madam Chair. 1026, you should have a substitute amendment before you.
The substitute has been moved and properly seconded. All those in favor, please say aye. Any opposed? If you'd like to talk about the substitute.
This bill actually helps us all feel better, but I'll explain it. HB 1026 is a workforce bill that helps Virginia being a qualified chiropractors who have trained outside of the United States. Right now, even experienced chiropractors who have been safely practicing for years in other countries face major hurdles in getting licensures here, even when the education and training are very similar to ours. This bill allows the Board of Chiropractors to issue a Virginia license by endorsement of foreign-trained chiropractors if they meet the standards. To qualify, the applicant must have a chiropractor degree from an accredited institution in their country, hold a certain unrestricted license in that country with standards similar to Virginia's, and have at least 2 years of active practice, have a clean professional and criminal record, be legally allowed to work in the United States, and pass the same national board exams as required by our U.S. chiropractors. This bill would not lower the standards, but would help address the workforce shortage. The key part is this is by the Board of Chiropractors that would accept these licenses.
So, ma'am, that's the, excuse me, Madam Chair, that is the bill before you.
And
I don't know if I have anybody here to speak if you have questions.
Well, we'll get to that real quick. I just want to make sure, because in the introduced version, there was no exam. In the substitute, it is with an exam, correct? Okay. And coming to the subcommittee, Delegate Tran.
Thank you, Madam Chair. I'm just, can you just clarify once again, Delegate, a question for the patron. I think you said hold an unrestricted license with the same standards in their home country. So they have to currently hold that license?
Yeah, they would have, Madam Chair, speaking to the delegate, they would have to maintain the same type of standards in their country that any chiropractor would. So when they come to America, those standards, I mean, if they want to practice, the standards that are required by the U.S., by our citizens here that are chiropractors would have to meet the board standards. So we're not accepting just anybody. These are folks that have to meet the same standards that we require here in our country, established by the Board of Chiropractors.
A follow-up, Madam Chair. I appreciate the guardrails that you were putting into the bill, but my question was more around: do they have to currently hold the unrestricted license in order to apply for this pathway to licensure in the United States or in Virginia?
I don't know if there's somebody here that could help me out. If we could yield to a professional.
Absolutely. Good morning, Madam Chair. Bo Keeney, representing the Virginia Chiropractic Association. That accreditation essentially means you have to have graduated from either a U.S.-based or international accredited program recognized by the National Chiropractic Association. You would then be eligible to sit for the national licensing boards, which would be the Part 1, 2, and 3. And then as a foreign trained chiropractor, you'd also be required to take the SPEC exam, which is qualified for those international chiropractors.
Delegate Tran.
Thank you so much, Madam Chair. And the reason why I'm kind of focused on this little piece is I was able to pull up the substitute. This is where I wish I had my readers, but it says you have to currently hold a current unrestricted license. So many of our immigrants and refugees who would qualify for this pathway, if they have lived here for any number of years, or even, or even if they were a recent refugee but had to leave their country, it takes the time period for refugees to come into the country and be resettled can be pretty lengthy, right? It is difficult to still maintain a current unrestricted license from your home country if you have lived and been a resident of Virginia for the last, 5 years or such. So I just want to point that out. Then that really limits who this would impact.
You've got a better answer than I have. I can understand circumstances by which people come from a foreign country to our country to continue their professional practices they already have here. I'm not sure I can answer specifically, any issues regarding immigration, things like that. In other words, when they come to the United States to continue their practice, they're going to have to follow every law that's established by the United States, whether it's immigration, whether it's the Board of Contractors, whatever, to be able to practice, but still meet the same requirements that any U.S. Doctor of chiropractic would require. I hope that.
Mr. Chair, Madam Chair, I'm sorry. Madam Chair, I'm looking at the delegate. Madam Chair, I agree with that premise. I just say, if you want to be able to include more folks, and I would offer as a friendly amendment, something along the lines of held or currently holds, so that you are allowing folks who are now living in this country who had a license, graduated from the appropriate institutions and such in their home countries, got that approval, but haven't been able to practice here, prove that they had a license at home, they've lived here for now 5 years, met all of these additional requirements to maintain patient safety, that they could then enter into this pathway. So I would offer that if you take that as a friendly amendment.
Madam Chair, yes, I would accept that as a friendly amendment. We wouldn't have any problem with that if they were been here in the United States, but for any period of time, and yes. So that friendly amendment would be acceptable.
The amendment has been moved and properly seconded. All those in favor, please say aye. Any opposed? So that substitute is now amended-ish, working on it. Delegate Hodges.
Thank you, Madam Chair. And my question would be, if you, and I agree with the amendment, but if you held or currently hold, if it's 5 years or 10 years, and what about CE requirements catching up and so forth as well? So that, could that actually become an issue? Because if you haven't held a license, say for 5 years, then you need to have that CE since you didn't have that license, which
Madam
would be
Chair,
in current
Keeney.
practice for any other health profession in Virginia.
Okay. Madam Chair, Bo Keeney with the Virginia Chiropractic Association. Again, Delegate Hodges, what I would tell you is these are all criteria that make it eligible so that you can then go sit for the National Licensing Board. Once you do that, you would be issued a license and are then held to all the same continuing education standards. So you're going to have that high bar of having to go past the national boards plus that special exam. And then after that, you would be held to all the same continuing education licensure requirements of anybody under DHP.
Any other questions or comments? Yep, let's turn to our council.
Madam Chair, I just want to flag for Delegate Tran as well as the subcommittee that if we include holds or held a current unrestricted license, that could also include persons who've had disciplinary action or had their license revoked. I'm happy to work with the patron to keep the umbrella where we want to. In terms of someone who's had an unrestricted license is not, able to show the current unrestricted license, but also has not had their license revoked or something similar. Just wanted to flag that if we, it will need some additional language unless we want to bring everyone under the umbrella, which is also, it's, up to the whim of the subcommittee and the patron.
Madam Chair, would it be
Delegate
possible? Madam Chair, would it be possible to kind of change our motion to adopt this amendment in concept so that council can fine tune it as we move to full committee?
Yeah, and Mr. Council, would that be, sorry, Mr. Brooks, would that be a new substitute? So would the motion still be report with substitute?
Madam Chair, since it would be report with substitute, since we can make these changes in the existing substitute and have that be the one that's adopted by the subcommittee and also by the full committee later on.
Okay. Before we get to any motions, then we'll turn to public comment. And anyone who wants to speak in favor of House Bill 1026, please come forward.
Madam Chair, Bo Keeney again, Virginia Chiropractic Association. We had actually some pretty large concerns with the bill as introduced, but thank Delegate Walker for working with us. Really, the problem was there was not a pathway at all for a foreign-trained chiropractor to come and obtain licensure in Virginia. So with the substitute that is before you, it actually will provide a pathway for foreign-trained chiropractors to obtain licensure in Virginia, but it sets that minimum standard that any United States practitioner would be held to as well. So there is a floor that is put in place that puts everybody on equal ground, but it does establish the pathway. So with the substitute, we do support the bill.
And the amendment.
And the amendment.
Anyone else to speak for House Bill 1026? Is there anyone to speak in opposition to House Bill 1026? And seeing no one online, coming back to the subcommittee.
Move the amended substitute. Move to report the amended substitute.
Second. So right now it is to report the substitute, and we'll have that amendment coming. It's been moved and properly seconded to report with substitute House Bill 1026. Madam Clerk, please open the rolls and members cast your votes. And that is recommended to be reported with a vote of 8-1 with substitute. Thank you, Delegate Walker.
Thanks, Madam Chair.
We'll now turn to Delegate Tran.
Thank you, Madam Chair. If it's okay with you, I can present from here. All right, I have House Bill 1489 before you. You ready for me to start? All right. According to the Bureau of Labor Statistics, healthcare workers are 5 times more likely to experience workplace violence than other workers in various industries. A 2024 survey published in the Journal of the American Medical Association found that healthcare workers in large urban emergency departments experience workplace violence once every 3.7 shifts, 25% of which involved physical violence. So these incidents aren't abstract, and when hospitals are forced to lock down units or close doors because of violent threats, patient care is disrupted and access to care suffers. Last year, the General Assembly passed legislation requiring hospitals to record incidents of workplace violence against healthcare workers in an internal reporting system. That bill also directed stakeholders to come together to determine how this information can be responsibly shared with the state government. So this bill reflects the recommendations of that work group. It requires hospitals with an emergency department to collect data on workplace violence incidents, report it to the Virginia Department of Health, who will then report that information publicly in an aggregated form. The bill protects anonymity. No patients, employees, or individual facilities are identified, and it is not meant to be a gotcha, but rather to help us understand more what is happening and how do we keep both our healthcare providers safe and that our patients can have continuity of care. So this bill will give medical professionals, hospital systems, and the public a clearer picture of the scope and severity of the problem so we can respond with evidence-based solutions while maintaining privacy and security. We are supporting our healthcare workforce, helping to address issues of burnout and retention challenges, and ultimately to make sure our patients receive the best care possible. Thanks for your time. I look forward to your questions.
Thank you, Delegate Tran, and I know you've been working on this for a while, so thank you for bringing these recommendations forward. Are there any questions from the subcommittee? Seeing none, is there anyone here to speak in favor of House Bill 1489? Please come forward.
Good morning, Madam Chair and subcommittee members. I'm Sarah Nicely. I'm a physician assistant and the immediate past president of the Virginia Academy of PAs. On behalf of the Virginia Academy of PAs, we support this bill.
Thank you.
Madam Chair, members of the subcommittee, my name is Allison Flynn. On behalf of the Medical Society of Virginia, we are in support of this bill, and we thank the patron for bringing it forward. Thank you.
Madam Chair, members of the committee, Brent Rawlings for the Virginia Hospital and Healthcare Association would also like to thank the patron for working with us and the other stakeholders to get this bill into a good spot. This is something that our hospitals take very seriously. It will take a lot of work to implement, but hopefully we've done this in a way that will produce some very actionable and reliable information that will help inform our policy decisions going forward. So thank you.
Thank you. Is there anyone to speak against House Bill 1489? And we have potentially Dr. Lesko, maybe? Well, we will note Dr. Lesko's support from the Medical Society of Virginia on House Bill 1489. Coming back to the subcommittee. Delegate Tran, did you have anything else you wanted to add?
No, I think that covers it, Madam Chair.
Madam Chair, motion when appropriate.
This is the appropriate time.
I would move to report.
It's been moved and properly seconded to report House Bill 1489. If the clerk will please open the rolls and members cast your votes. And that is recommended to be reported on a vote of 9-0. Delegate Tran.
Madam Chair, before you I have House Bill 1036. And I do have a line amendment. This actually gets at the issue that I was trying to address in the previous bill we heard just a few moments ago. On line 28, after the Delegate Hodges and I were trying to figure out what to call these things, but the baby eyes, the baby twos, Romanet 2, insert were or, so that the line reads were or is eligible to practice dentistry in a country or jurisdiction outside the United States.
Can I get a motion and a second on the amendment? It's been moved and properly seconded to adopt the line amendment. All those in favor, please say aye. Any opposed? It is now amended before us.
Thank you so much, Madam Chair. Across the Commonwealth, patients are waiting longer for basic preventative dental services. I think this bill takes a modest step to help our practices meet patient needs while maintaining patient safety and tapping into underutilized workforce in Virginia. So I first want to talk a little bit about how do we help meet patient needs while maintaining patient safety. The bill allows the Board of Dentistry to consider licensure applications from foreign-trained dentists who've met all of the following criteria. 1, they've had to graduate from dental school outside the United States. 2, were or is eligible to practice dentistry abroad in their home countries. And then the following 3 requirements are also similar to what current dental hygienists have also must also demonstrate. They must be of good moral character, pass the dental hygiene examination given by the Joint Commission on National Dental Examinations, and successfully complete a clinical examination that's acceptable to the board. This bill does not do the following. It does not create automatic licensure. It does not expand scope of practice, and it does not bypass the board. I want to talk just a little bit about who would be eligible for this bill. Mostly, similar to our previous conversation, these are immigrants and refugees who are living in Virginia but are not practicing dentistry, right? You may have come across their paths and not know it when you've taken an Uber or a Lyft or a taxi. Those are often some of the stories we hear when we have foreign-trained professionals who are now not able to reach their full potential, career potential here because of various licensure and economic barriers. I want to take a moment to share my father's story. So when I came to the United States in 1980, my dad was in his early 30s. He'd been a practicing dentist. He served in the South Vietnamese, Army. And when we came to the U.S., here he is, somebody with a 2-year-old in his mid-30s. He didn't have a lot, very strong English skills, and to this day, his preference is to speak in Vietnamese. We were not in a position for him to obtain his dental license again. At that time, and I was resettled in California, he had to graduate from a dental school. We had neither the money nor the language skills for him to do that. Or he could go and take his boards right away. He would still have to, study for that, and he couldn't. He had a young family to provide for. I remember watching my father study for his boards 14 years after we resettled. He'd be working 10-hour days and come home and continue studying until about midnight. And I'd come in 8th grade with my algebra homework, and he'd pause and he'd help me. These are the individuals. I'm getting a little emotional. I have a whole heck of a lot of respect for my dad and for these folks who have, many of them who have experienced escape and resettlement, to come here and to rebuild their lives only to face tremendous challenges and barriers to just practice and do the work that they've been trained to do. But these are the individuals that we're giving an opportunity to. There's a concern that we're suddenly going to be overwhelmed with all of these immigrant and refugee doctors trying to become dental hygienists. And that just simply is not the case, right? That really isn't. There's not a whole lot of good data about how many foreign-trained dentists are in the United States or in Virginia, but I can give you 2 examples, or one example that I think helps to illustrate the scope. In Utah, they passed a program for full dental licensure, and have no fears. I have told the Dental Association that this bill is not a ceiling, but rather a floor, and we will continue this conversation. But in Utah, there's a program for full licensure. It took effect this fall. A total of 3 dentists, foreign-trained dentists, have enrolled for full licensure. There have been 11 Virginia foreign-trained dentists who have reached out to the Utah office and have said, hey, we're kind of interested. We would actually be willing to move to Virginia because we want a pathway, or to move from Virginia to Utah. That's not scores and scores of people. This is a very modest step to help address a workforce stress and at the same time provide an economic opportunity for folks who are trying to really hard to provide for their families and to work with some dignity. And I welcome the conversation today. Thank you.
Thank you, Delegate Tran. Are there any questions from the subcommittee? Delegate McGuire.
Madam Chair, not a question, but speaking to the bill, if that's okay.
Let's do questions first. Any questions? Seeing none, Delegate McGuire.
Thank you, Madam Chair. I really want to thank the patron for bringing this bill. My district is right next door to Delegate Trans, and so we share a lot of similarities in the folks that we represent, which is a vast range of different backgrounds, cultures, and skill sets. A lot of those folks are here to try and live out the American dream and come from countries with certifications or education that we do not recognize here in America. I know personally of an individual that we worked with at the nonprofit United Community that I used to be the board chair of, who came to this country from Nigeria, had a master's degree in cybersecurity. It meant nothing over here, and the only job we could find for him was a school bus driver for Fairfax County. So to be able to provide these individuals with a path to help our citizens with the care they need, I think is tremendous, and I'm very eager to support this bill. Thank you.
Delegate Griffin.
Madam Chair, speaking to the bill, I am America first. And America is for Americans. America is for American workers. And I understand, and this is with respect to the patron, because she's very kind and I think comes from this from a good place. I understand that there's a shortage of dentists, but like the answer is like right in front of our eyes. Help me out here. We graduate more people from dental school, right? We accept more people to dental school. We don't flood the country with people from other places to come and take American jobs. The answer is literally right in front of our eyes. I was on transportation before this, and they would say, okay, well, this is just a bill for flock cameras, not going to become a surveillance state. This is just license plate readers for cops. It's not going to become a surveillance state. This is just a bill to allow police officers to bypass the warrant requirement. It's not going to become a police state. This is just, and it was like every day it was just one little thing. And so like this is just a bill to allow the dental hygienist, and the last bill was just a bill to allow the chiropractors, and the next one will be just a bill for the optometrists, and the next bill will be just a bill for the lawyers, it'll be just a bill for the scientists, it'll be just a bill for the college professors. But guess what, Madam Chair? It adds up. We are here to represent Americans. We are here to represent Virginians. There is a clear and better way to do this, and so I would ask my colleagues to oppose the bill. Thank you.
Delegate Cole.
Thank you, Madam Chair. Speaking to the bill.
Delegate Cole.
I think so often we forget that America is a nation of immigrants, and everyone here in America did not originate here in America. And in order to give people the opportunity to achieve the American dream, we have to have the ability to make sure there's a pathway to success, and especially when we have a shortage. And in the meantime, we can do something with that. And so I'd ask my colleagues to overwhelmingly support the initiative.
Chairman Willett.
Thank you, Madam Chair. And I tried to let the committee do its deliberations and just be part of the peanut gallery over here, but sometimes I need to speak up. I do wear, like a lot of us, multiple hats, Madam Chair. One of those is the chair of the Virginia Health Workforce Development Authority. It hasn't added up. I see the numbers every day. I spend more time on health workforce issues than anything else I deal with. And it doesn't add up. We do not have enough professionals providing these services. This is one way to get at that. We have one dental school in Virginia, one, and one that actually we need to replace in terms of the physical plant there. That's another story. But we need to do better by that training, but certainly this is one way to address what is absolutely a critical need for this support. So I just want to associate myself with strong support for this legislation. Thank you.
We will now turn to public comment. If you are here to speak in favor of House Bill 1036, can you please raise your hand? Okay. And if you're here to speak against House Bill 1036, if you can please raise your hand. Okay, so we'll give 5 minutes to each side, starting with the support.
Madam Chairman, Scott Johnson here as General Counsel for the Virginia Dental Association. We very much support this bill. I think it is important from the start to say this is not an issue of dentist versus hygienist. We need both on the team. This is an issue to address your constituents and your family members who complain to you that it takes a year to get their teeth cleaned. We have a severe shortage of hygienists in the state, approximately 1,000. When you peel back and say, why is that the case? 1,000 people licensed that are not working in Virginia, and you start looking at the details, roughly 627 of them reported to our health professions that they work in another state or in a federal entity. Roughly 127 maintain an active license, but they're retired. Roughly 120 choose not to practice, at least not full-time. Therefore, the available workforce data only shows a handful of people when we need 1,000. The Dental Association reached out to the hygienist back in the fall, and we've been working on this 2 years to say, hey, come up with ideas. We've got to solve the workforce. We bring these ideas to you and want to thank our patron for doing this. You may ask yourself, well, is Virginia first looking at trying to give a pathway for foreign-trained dentists to be licensed as hygienists? And the answer is no. Florida has done it since the 1990s. Connecticut does it. Massachusetts, our neighbor in Kentucky, Vermont. And recently, the Council on Dental Accreditation has authorized foreign-trained dentists to teach in dental hygiene programs. Let me say that again, foreign-trained dentists to teach in dental hygiene programs. We are seeing foreign-trained dentists here in Virginia, as Delegate Willett mentioned our dental school, 800 foreign-trained dentists applying for 10 slots. So they are here, they're working in the offices as we go through this. The Virginia Association of Free Clinics has provided a letter in support of this legislation because they see with the cuts coming from D.C., dental is the biggest area they're going to be called upon, and they need help in that area. I'm going to turn it over now to Dr. Neil Turnage, a practicing dentist here in Richmond, so he can give you the numbers that are from his practice. Thank you.
Hey, Madam Chairman. I'm Dr. Neil Turnage, and I'm representing not only as a member of the Virginia Dental Association, but Virginia Family Dentistry here in Richmond. We have 17 offices. We are doctor-owned by the doctors that are practicing every day. And I can tell you some statistics that we had. Most of our patients are waiting 8 to 12 months to get their 6-month recall, which puts them behind, which makes it more difficult. In the last 2 years, we have 36,272 patients that have not been able to reschedule their appointments at all yet, so that waiting list that long. If you call our offices now to get a new patient visit, you're waiting 12 to 18 months to get that visit. Most patients that are rescheduling, if they have to call and cancel an appointment, they're going to be waiting 12 months to get their recall rescheduled. It is a problem that we don't have enough hygiene students graduating every year in the state. That's another whole issue from what you're dealing with now, but hopefully you will deal with that at some point because we do not have enough graduates every year. I've been working on a task force with the VDA that's visiting hygiene schools, trying to get them to take more students so that we can do that way because we want hygienists. Today, my practice alone in the Richmond area could hire 23 hygienists today. I could hire the whole graduating class from VCU today. That being said, we have 2 foreign dentists that went back to school and became trained as dentists, and they work in our practice as doctors in there. We have 3 foreign trained dentists that are excellent assistants in our practice right now that have found a way to do some of what they can do. This would be a great avenue for them. This is a great pathway for that. It's also a great pathway to help support our needs of our patients, and our main thing is accessibility for our patients. We're built on that. Thank you.
Thank you. Come for it.
Sorry, be very quick. Nicole Lauder on behalf of the Virginia Association of Free and Charitable Clinics. As Scott mentioned, we are in support of this bill and appreciate the effort to address the workforce shortage that we're experiencing at the free clinics. So thank you.
All right. Is there?
I'm sorry. I'm Dag Zapatero. I'm a general dentist in Virginia Beach. I thank Delegate Trang for bringing this bill up. I think it is, like Mr. Johnson said, it will help foreign-trained dentists teach in dental hygiene schools and, in a way, make America first and help our kids from the United States be able to seek a pathway into dental hygiene.
Thank you. If you could identify yourself and your position.
Yes. Good morning, Madam Chair. Heidi Cook. I'm speaking as a private resident today on behalf of Angela Arango Ocampo, who is watching online. Angela is a special friend of mine who has a son at St. Edward's Catholic School in Chesterfield County. She is a homeowner in Chesterfield County, Virginia. She attended the Universidad of Antonio Nariño in Colombia. She is considering a move to Florida this summer because she cannot practice to the extent of her education and degree here in Virginia. And with all due respect, we want to keep Virginians employed in Virginia. We want to keep them as active community members in Virginia. And so I urge you to support the bill on her behalf. Thank you.
Thank you. And those that are speaking against House Bill 1036, if you could please line up. And because we went over, I would like 6 minutes on the clock. Thank you.
Thank you, Madam Chair. Barrett Hardiman on behalf of the Virginia Dental Hygienists Association. We are opposed to this bill. We have a tremendous amount of respect for all immigrants who come to the United States looking to make a better way for themselves and their families. However, not all dental schools are created equal, and dental schools are definitely not the same as dental hygienist schools. They teach very different curricula. Just want to note that there was a work group that met this summer, and there was no consensus on how to move forward with this prospect. The representatives from the Virginia Dental Association offered a number of guardrails from that study that are similar to what was put in House Bill 1026 for chiropractors that are not in this bill. Additionally, this bill exempts regulations from the Administrative Process Act, which when we know that there is dissent, we feel like there should be significant public input as those regulations are being written. Thank you, Madam Chair.
Madam Chair, my name is Jessica Sudbeck, and I'm a licensed dental hygienist and an associate professor in a dental hygiene education program here in Virginia. I'm here today to strongly oppose HB 1036, legislation that would allow internationally trained dentists to obtain licensure as dental hygienists in Virginia without completing a Commission on Dental Accreditation accredited dental hygiene education program or the required hands-on clinical training specific to the profession of dental hygiene. In opposition to this bill, I would like to share the lived educational experiences of a recent graduate of the Bachelor of Science in Dental Hygiene program that I teach in. Lily Salazar, class of 2025, entered the United States already licensed and trained as a dentist in Peru. Despite her prior dental education and clinical experience, Lily chose to complete the full CODA-accredited dental hygiene program at ODU in order to practice dental hygiene in the United States. Upon enrolling in ODU in the School of Dental Hygiene, Lily completed the same prerequisite coursework and full 2 years of dental hygiene curriculum required of all students. Although ODU carefully evaluates prior education for transferability, none of her previous dental coursework was deemed equivalent to the dental hygiene prerequisites or core curriculum courses. With Lily's permission, I am sharing testimony that she provided as she could not be here today, which directly speaks to the assumptions underlying HB 1036. I never imagined that being a dental hygienist in the United States would be such a challenging yet rewarding career. Although I'm a dentist with a degree from Peru, it did not lessen the intensity of the studies required for the dental hygiene profession. My ODU education provided me with a solid foundation in dental anatomy, dental materials, prevention, and other essential subjects. However, the scope of dental hygiene was entirely new to me. Learning about the various scaling and root planing instruments, as well as how to perform different treatments, presented a steep learning curve. I also had to adapt to state-of-the-art digital radiographic equipment and understand the ALARA guidelines while performing radiographic examinations. I hope that all international dentists come to recognize the importance of dental hygiene as a specialized profession that deserves to be taken very seriously. With my dental degree studies in Peru had periodontics condensed into just 4 months, dental hygiene is an entire career and it should be viewed as a specialty within periodontics and treated as such. Thank you for your consideration of my testimony, Lily Salazar. I want to share testimony from one other graduate from 2023, Fernanda Vasconcelos Rossi, who is a former dentist from Brazil. She says, I am sharing my personal experience as an internationally trained dentist, which speaks directly to the importance of proper education and preparation of the dental hygiene profession. My name is Fernanda Vasconcelos Rossi, and I'm a dentist originally trained in Brazil. After coming to the United States, I learned that in the state of Florida, internationally trained dentists may have the opportunity to become hygienists by completing the board examinations. At first, this pathway seemed like a faster option. However, I quickly realized that providing oral health care is a serious responsibility, and I did not feel it would be ethical to treat patients without being fully prepared for the specific scope of dental hygiene and the standards in the United States. Because I take patient care very seriously, I made the decision to enroll in the dental hygiene program at ODU. She continues to go on about her experiences, and she now teaches in the periodontics department and the University of Florida because of her experiences in our dental hygiene program. These summaries of the lived experiences of our internationally trained dentists who have graduated from our program really speak to the specialization of dental hygiene that require rigorous and specific education. For that, I urge you all to oppose this bill now and not let it get any further. I just want to add that I do have some x-ray evidence as well that will be too difficult to show you right now, so I'll make sure to email it to the entire committee. Thank you for your time.
Madam Chair, Marlene Rhodes. I have been asked to speak for the program head of a dental assisting department, who is also an internationally trained dentist. He wanted to tell you that the education received in most internationally trained dentists is different from the education here in the standards in the United States. We are trained in restorative and surgical procedures with little to no training in preventive disciplines. Yes, it is a separate discipline. Yes, we are taught the basics and we have enough of it to get through our degree, but the level is not that of a dental school here, much less the hygiene curriculum. Yes, we go through anatomy, theory, pharmacology, and multiple other overlapping didactic courses, but they are geared toward dentistry, not towards hygiene. I am of the opinion that internationally trained dentists should not only go through a hygiene program, but to obtain a hygiene license, they should all have to go through at least a accelerated CODA program.
Madam Chair and Committee, my name is Brenda Bradshaw. I'm a licensed dental hygienist and associate professor in dental hygiene. I'm here to strongly oppose HB 1036. Florida provides a clear and cautionary example. In the 1990s, Florida began allowing internationally trained dentists to become licensed dental hygienists by meeting licensure requirements such as examinations and credential review without completing a dental hygiene program. Between 2010 and 2012, there was a sharp increase in applications from foreign-trained dentists, which drew public attention and controversy in Florida. Today, Florida residents continue to raise concerns. Most importantly, workforce substitution has not solved access to care shortages. Despite aggressive policy changes, Florida currently ranks last in the nation for dental access. It has the lowest rate of children receiving dental visits, and 65 of its 67 counties remain federally designated dental health professional shortage areas, even after permitting foreign-trained dental practice.
Thank you.
As hygienists.
Thank you. There is a website that you can go on to put in the rest of your comments, especially if you did not get to speak. But we're going to turn it back to the subcommittee now. Or was there somebody online?
Yes. I don't see him.
Brenda Bradshaw? Yes. Oh, you already, okay. Yeah.
You want me to come back up?
No, I was going to go to online. Coming back to the subcommittee.
Madam Chair, can I have
Oh, sorry. Absolutely, Delegate Chair.
Just as final comment, Madam Chair, I have a feeling that my colleague down the dais and I will probably have a battle royale on the floor around some of the comments that were made earlier. I do want to note, and I'm mindful of what you said about taking some of these things to the floor. I do want to note, though, and clarify just on the healthcare piece, 14.5% of Virginia's healthcare workers are immigrants. And we need to exercise a lot of caution when we try to define or exclude folks from the definition of who is an American worker and what those workers' contributions are, but we'll save that for the floor. I think that this bill helps to provide some good guardrails and makes sure that those foreign-trained dentists living in Virginia who want to take this path are able to pass the examinations that we have discussed earlier and give them an opportunity. And I think that there will still be a lot of continued workforce stresses in this area. I think this is a modest step forward. Thank you, Madam Chair.
Coming back to the subcommittee.
With amendment. With amendment.
It's been moved and properly seconded to report with amendments House Bill 1036. If the clerk will please open the rolls and members cast your votes. And that is recommended to be reported on a vote of 8-1. I am going to turn this meeting over to Madam Chair Tran.
Thank you so much, Madam Chair. Would you like to present your bill?
House Bill 970, and Madam Chair, I do have a substitute.
All right. There's been a motion to move and properly seconded. The substitute, all those in favor say aye. Aye. Any opposed? All right, Madam Chair, would you like to report that substitute, or would you like council to?
I can in the description, if that's okay.
All right, would you like to describe your bill as substituted?
Yes, thank you. As most of you know, my dad is a dentist, and that's how I got into dental office management for 10 years in the front office, while my brother went to school to become an oral surgeon. I learned a lot about managing successful dental practices, and one of the hardest things was having the dentist tell a patient they needed to get a dental cleaning immediately for their own well-being, and then they got to the front for scheduling, and we offered them a hygiene appointment 8 months away. My dad has retired from that practice, and when people asked me for recommendations for a new dentist, they found that every office was booked for months and not taking new patients. I thought it was just in my area, but talking with dentists and patients from around the Commonwealth, anecdotally, people are having to wait months for appointments. This is concerning, but especially for my friends who are pregnant, have diabetes, have braces, and have heart disease, who are supposed to see the dentist more frequently. At a dental conference I attended, several members of the Old Dominion Dental Society expressed issues with recruiting, retaining, and affording dental hygienists, which has caused a backlog in scheduling appointments at their offices. This became an issue for them and other dentists I spoke with who wanted to take on more Medicaid patients since we expanded Medicaid coverage of dental procedures, but could not afford to. At the same time, we were finding out that a program for dental hygiene school was experiencing issues. So several stakeholders got together to develop creative ways to enhance dental workforce development and improve patient access. This bill is about both. It would allow dental assistants with 1,800 hours or more of clinical experience to obtain certification to assist with basic functions during dental hygiene appointments under the supervision of a licensed dentist or licensed dental hygienist. An 8-month IRB-approved study in Missouri of a similar role found no adverse events and no patient complaints across more than 1,600 patient visits, with dental assistants providing this limited preventive care. This bill is supported by dentists, the free clinics, and the Virginia Community College system. It is also being carried in the Senate by Dr. Todd Pillion. I hope you will look favorably upon this bill to help with patient access across the Commonwealth, and I look forward to the discussion.
Thank you, Madam Chair. Are there any questions from the committee? Okay, I don't see any. Are there folks who wish to speak in support of the bill in the room? If you could please stand, and we will ask both sides to limit comments to 5 minutes as previously.
Madam Chairman, members of the subcommittee, Scott Johnson is General Counsel for the Virginia Dental Association. So for our 2-year work on trying to help solve the workforce crisis, this is part 2 of what we bring to you today. The foreign train was one and this one, and we fully support this and ask you to as well. We have approximately 8,000 dental assistants in Virginia, and you have 2 types of dental assistants. One is a DA1, creatively named. And some years ago, to try to address workforce, we passed Dental Assistant 2, and there are only approximately 55 of those licensed in the state. A DA2 takes modular training, if you will, to perform certain tasks. And so the idea is, if we've got those dental assistants and we want to have a workforce advancement pathway, a career ladder, that those individuals would be able to get additional training to do 2 things. Scale the teeth above the gum, technical term, supergingival, and 2, polish the teeth. There are key requirements of how to get this additional training, and the pathways include this: on-the-job training with a curriculum that will be developed. These individuals don't have time to go out to get necessarily training or the ability to afford tuition, so that is one of the pathways. Two, the military has done this for years. Assistants have been involved in scaling and polishing. If they've gotten the training in the military, we don't need to replicate that. We just need to verify it and move forward. Indian Health has done this as well, and also our current dental assistant programs. If a person does want to go get training there, that's another pathway. So if I'm a dentist and I've got a dental assistant, one or two, that wants to pursue this, then those are the educational pathways. But then a safeguard, it comes back to me as a dentist that I've got to watch them do 20 cases and certify under oath that they have the training, they're able to do that. Providing these services in my practice, a second safeguard. I, as a dentist, can only supervise 2 of these assistants when they're scaling or polishing. It's not going to be something that is opened up like a pill mill. So you ask yourself, what other states have done this and what is the history? I mentioned in the military, from our account, it's over 50 years. 50 years that our service personnel have had assistant scaling. Kansas has had it since 1992. Indian Health has had it a long time. Illinois, Arizona since 2005. Missouri just completed a pilot program. And I started off my remarks on the other bill talking about your constituents and your satisfaction of your family members. Missouri had 1,682 patients that were treated by assistants in their practice. 2 things were relevant. Number 1, no safety issues or problems. Number 2, the patient satisfaction was through the roof. And that is who we're out to look for. There are regulations that the board would develop from this that the Dental Association and the Hygiene Association will work on in the off season. And I brought with me today Dr. Ray Lee and Dr. Kurt Keller so they can give you a perspective from the trenches. Thank you.
Thank you. Good morning.
Good morning. I'm Dr. Kurt Keller. I've been practicing dentistry for 35 years. I'm also chairman of the Central Virginia Dental Care, which is a corporation with umbrellas with 64 locations, 110 dentists, and 351 assistants. I'm here to answer the workforce cry from help from the 64 locations that we have. I personally have been looking for a dental hygienist for 3.5 years. I brought Nicole with me, who's been my right hand for 20 years, and her skills are unprecedented. If you allow her to be a scaling assistant, there are many guardrails in place. She'll be working under my direct supervision, and when Nicole completes her task, I will be doing evaluation under magnification to make sure the patient has had therapy that is complete. The bill does not make Nicole a dental hygienist, but allows her to perform a defined skill and task that will help provide some access to care, and I appreciate your support.
Great, thank you. Is there somebody else? Good morning.
Good morning. Thank you, Madam Chair, fellow members of the subcommittee. My name is Dr. N. Ray Lee. I am a full-time practicing oral and maxillofacial surgeon on the Virginia Peninsula. I started my dental career at 19 years old as a chairside dental assistant, where I was taught to scale and clean teeth. I then went on to do 2 years of a dental hygiene schedule in the United States Air Force. I currently went on to graduate from the College of William & Mary, Baylor College of Dentistry, and the residency program in oral and maxillofacial surgery here at VCU. So this bill is safe, it's effective, in greatly reducing the wait time for citizens of the Commonwealth to achieve preventive dental care. So thank you for your support.
Thank you very much. Our time is up, but were you here, sir? No, okay. Nicole, are you? No, okay. Do you just want to?
Yes.
Thank you.
Nicole Lauder on behalf of the Virginia Association of Free and Charitable Clinics, and we support the bill. Thank you.
Okay, great. Thank you. If those who are here in opposition to the bill would please line up, and because we went over just a tad, I'm going to add an extra minute. So if we can change the clock to 6 minutes for this side, that would be great. All right. Thank you, Barrett.
Thank you, Madam Chair. Barrett Hardiman on behalf of the Virginia Dental Hygienists Association. Just want to note the Missouri pilot project was brought up, and I'm going to read to you directly from the report from the Missouri Dental Association on that project. The pilot project study did not demonstrate a significant increase in clinic capacity or improved access for more serious periodontal patients. So the problem we're trying to solve here, which is access and capacity, this program didn't solve it. There is a Johns Hopkins study with Indian Health Services that did a similar study several years ago, and what they found was that each individual patient had more access to additional services from the dentist, but practice capacity actually went down when you were using the dental assistants for advanced procedures. So thank you. There are a number of other people here to.
Thank you.
Yes, Dag Zapatero, former member of the Board of Dentistry. My concern is safety, patient safety. This is a picture of somebody who presented to my office, and to you it looks like she reported she bit her tongue. This is squamous cell carcinoma that's in the mouth, okay? This is what an OPA is going to have to treat. And they're going to, in 120 hours, I'm sorry, you're not going to learn how to do pathology in 120 hours. The Board of Dentistry provides some safeguards. Licensure. If I have a license and I have drug abuse, whatever, they could pull my license. This person, there's no, if somebody is into drugs, jailed, whatever, their license, their certificate remains and they can get a job someplace else. That's a problem to me. Licensure is the minimum. We require beauticians, cosmetologists to have 1,500 hours of training plus licensure and regulations. This person should just be held equal to a cosmetologist. You need to know that the Missouri bill, while that was a 3-year study, the legislature decided not to codify it into law. So that never became into law. Kentucky, they looked at it. It was pushed back and shelved. Nevada, again, time ran out. There was opposition. They didn't do it. Washington State, just this month, they also opposed it, and that committee shelved it. Illinois, while Mr. Johnson mentioned that they're allowed to do it, they can do coronal polishing, not scaling and root planing. That's allowed here. The only place that has passed it is one place, Arizona. This is not something that's been safe, has been proven safe for patients, and that is my concern. Thank you.
Thank you. Good morning.
Good morning. Barry Green, private practitioner. Hello, good morning for your allowing me to testify. I'm a board-certified periodontist, meaning of advanced training in specialty in diagnosing and treatment of diseases and implants, longstanding VDA member and life member of ADA. I've taught and lectured in 5 universities and consultant to the Surgeon General for Periodontal Services, Supreme Court of Virginia, consultant for periodontal services, and consultant for Delta Dental periodontal claims. I want to make a few comments about Bill 970, which I cannot support. Dental students have more time spent in areas of dentistry than periodontics, whereas dental hygiene students spend their entire education in dental topics, in diagnosis, physical assessment, pathology, treatment plan, and modalities and re-care. Second point, dental hygiene curriculum includes specific, more clinical hours of hygiene services than the dental school curriculum. Skill level of graduating hygiene students is superior to that of the dental students regarding prophylaxis and periodontal maintenance. Dental graduates are not provided courses in methodologies. And this was because of my clinical experience for 40 years teaching at VCU Dental School, dental students, dental hygiene students, as well as graduate students. The idea of a dental shortage needs a better solution than this House bill. What I know over 50 years of practice as staff, it's more dental assistants and more serious shortages there exist in the personnel. How would a dentist ever provide direct supervision to current DA2 and then provide indirect supervision to a DA1 scraping tooth surfaces while treating their own patients? Ask a dentist if they would prefer to have that service in their own mouth, and I'm sure most of them would prefer a dental hygienist or even over one of their colleagues as a general dentist. I've worked hard with a team of dental hygienists to obtain a healthy periodontium for my clients. I wouldn't want on-the-job training to attempt maintenance fragile, healthy new patients. Without competent care, these clients could once again break down and have significant moral issues. What about coding of insurance and what incomplete treatment? What about malpractice insurance? Remember that the DA1 and the DA2 do not have a license controlled by the Board of Dentistry to ensure public protection. So to end up, how many of you delegates would like your next cleaning by one of these tooth scrapers? I urge you to pursue protect the citizens of Virginia and vote nay to stop this bill. If bills passed in act and into law, I think your next dental appointment, you should be asking to see the license of your provider.
Thank you, sir. There's a long line behind you. Thank you. Good morning.
Madam Chair. My name is Kelly Schultz. I started my career in dentistry as an airman in the United States Air Force 29 years ago. I was served in the Air Force for 4 years. I was first a dental assistant. I assisted a dentist with very strict curriculum in dental assisting. 2 years in, I was made a Profi Tech. I thought at the time, this is great. I'm like a hygienist. That's what you think when you're there. And it allowed me to use instruments, ultrasonic scalers, hand instruments. And when I got out of the service, I used my GI Bill to go to dental hygiene school. I'm extremely passionate about this because once I got to dental hygiene school, I was shocked at what I did not know. I was a little bit mortified at the risk the patients were under my care with very little direct supervision from a dentist. The military model is very outdated. They don't do it anymore. That is why you can't get out of the service and just practice dental hygiene in the United States. I'm here to speak in deposition on behalf of Dr. Lee Melvin, as he cannot attend today. As a retired U.S. Dental Corps officer, clinical periodontist, and faculty member for the past 14 years in a Virginia dental hygiene program, I want to adamantly express opposition of HB 970, which have been put forward to passage in the Virginia Assembly. These bills, if passed and become enacted into law, would authorize the Virginia Board of Dentistry to certify dental assistants with limited or no experience to be trained by their employing dentist as certified preventative dental assistants. They would also be allowed to polish teeth and scale bacterial deposits supragingivally above the gum line with hand and ultrasonic scalers. I strongly oppose this bill for several reasons. One, lack of true standardized and certified educational training in a CODA, which is the Council of Dental Accreditation and certified program that dental hygienists receive over the course of at least 2 years. Standardized PDA training would be supervised and certified by employing dentists who, for the most part, are rarely certified dental educators who hardly ever do cleanings of any time in their practices. This would lead to very inconsistent skill levels by PDAs, which would increase the likelihood of patient not having supragingival deposits removed and, in turn, not improving the patient's dental health. Since PDAs with inconsistent skill levels would be allowed to use very sharp instruments, the chances of tissue injury that is not reversible is highly likely, which would also jeopardize the patient's safety. Second reason is PDAs certified to remove hardened supragingival deposits. In my experience as a periodontist, which is a gum specialist, many, if not most adults, patients have subgingival below the gum line deposits in addition to the supragingival ones. Although the intention of PDAs to treat healthy patients only with supragingival deposits, these deposits often extend subgingivally and would be left behind, leaving the patient to think they had a complete cleaning. Leftover deposits would make it much more likely that the patient's periodontal and gum health would get worse. Only dental hygienists certified by CODA-approved programs detect deposits below and above the gum line to effectively remove them all. His experience with military PDAs, I worked with Profi Techs, as they've been called in the military, who currently function as PDAs, and seen the effects of many patients treated by them, which includes inadequate removal of deposits, the lack of knowledge to whether there was remaining deposits below the gum line. As a periodontist in the Navy, I worked very closely with dental hygienists who often showed me their patients who were previously treated by multiple Profi Techs and had heavy deposits left behind, sometimes over multiple years. I also treated more severe gum disease when patients were previously treated by Profi Techs in remote locations and the service member thought they had a complete cleaning, but unfortunately, heavy subgingival deposits were removed.
Ma'am, the time had expired a bit ago, and I didn't want to interrupt you, but there is a long line of folks, and I appreciate that, and if you want to submit your written testimony, it'll be part of the public record. I know that the folks in this room have been waiting for a long time. I try to give equal time to both sides, so if you can at least come up and state your name and that you're in opposition, then at least we can record that for the public record, and please submit your written testimony as well. Thank you.
Heather Tuthill, and I am in opposition of this bill.
Thank you. Good morning.
Good morning. Thank you, Madam Chair and Committee. Melvina Peace, and I am in opposition of this bill.
Great. Thank you. I appreciate that folks have been in line, but this is not an opportunity for more folks to get up at this point. I do see you. And then I can ask at the end for the total hands, and then that will, at least we can visually see that. Please introduce yourself.
Hi, I'm Joyce Fiaskowski-Spieler, registered dental hygienist and a certified dental assistant.
Thank you.
Opposing this bill.
Thank you. Good morning.
Kristen Robbins, registered dental hygienist, opposing this bill.
Thank you. Good morning.
Good morning, Madam Chair. Ann Brune, registered dental hygienist for 20 years, educator for 16 years, all in the Commonwealth of Virginia. Opposition to this bill.
Thank you. Good morning.
Jacqueline Moran, RDH. I've been a hygienist for 45 years. I've taught in the Navy dental clinics at the PDAs. It is nothing but supervised neglect. I do want to, I'm sorry to take up your time, but the military standard is not health, it's readiness. How likely in the next 12 months someone would be medevaced off a ship or out of a school of action because of dental problems. The classes that they do is all aimed at that. We are not keeping people healthy by doing supragingival scaling.
Thank you. Thank you for sharing your perspective. And I think one of the earlier testimonies was covered the military experience. If you're in the room and you are in opposition to this bill, please raise your hand. Great. Thank you. Online, we don't have anybody who has signed up for the bill, but we do have one individual who signed up against. Lancette, I'm going to give you a minute. So if you can please share perspectives that have not been lifted up before, that would be appreciated in your time. Thank you.
Hello, good morning, Madam Chair and committee members. My name is Lancette Van Gilder. I'm the president of the American Dental Hygienists Association, representing more than 200,000 dental hygienists across the United States. And we want to stand firm to protect Virginians and strongly oppose HB 970. At the core, this bill jeopardizes the health and safety of the public and lowers the standard of care that is recognized all across the country. I want to thank the previous speakers who highlighted the states where legislation has been rejected, like Washington, Kentucky, and Nevada, because lawmakers recognize that patient safety must come before patient-driven profits. There is a clear conflict of interest when healthcare employers implement a system that bypasses college education and licensure and both trains workers and they financially benefit from their work. Healthcare providers should require licensure and education, and that should remain standardized, objective, and independently validated. Dental hygienists are the known prevention experts in dentistry, and we are deeply concerned about the solutions. And we do need solutions. We need to look at the why behind the workforce shortages. 2025 research shows that 50% of dental hygienists experience high rates of workplace bullying. Thank you. Thank you for your time. Thank you for your consideration and oppose the bill.
Thank you. And if you could, you're open to submit your comments by written form as well. Delegate Hodges, your hand is up.
Thank you, Madam Chair. Speaking briefly to the bill.
Go ahead.
Thank you, Madam Chair. As the pharmacist in me and the science background, I always look at the risk-benefit ratio. And when I look at this bill, I see the benefits outweigh the risks, especially when you have patients waiting months and months and months and months, waiting to, get their teeth scaled and cleaned and so forth. And preventive dental care actually prevents cardiovascular disease, in diabetes and in respiratory infections. So when I look at that, I think the benefits of this legislation far outweigh the risks.
Thank you. Delegate Hodges, are there any other hands up? Okay. Delegate Price, as the patron, you have the last word.
Yes, I just want to remind folks that I've been trying to get these type of bills to go to the boards because we are a part-time, part-time legislature. And so we bring our lived experience, our work experience to the table, and then we do rely heavily on experts. And so I do appreciate every single voice that came to this room, but not all of the experts in this field are in this room today. And so when you have bills that kind of pit sides against each other, it does get uncomfortable. And I'm usually the slowest to go to something quote unquote creative in order to get to something. But I really and wholeheartedly believe that, as Delegate Hodges said, the folks that need to see the dentist the sooner need to be able to get in. And those patients that were mentioned that have serious periodontal disease, that the hygiene chair can be for them. And so this is not replacing, but assisting, and the dentist is the one that will have that ultimate liability, and they overwhelmingly support this. So I really appreciate all of the voices, but I did not hear any solutions other than this. And so I am hopeful that we will continue to move this forward, like Delegate Senator Pillion's bill, so that we can get patients seen. Thank you.
Thank you, Madam Chair. The bill, House Bill 970, is before this committee, and we operate by motion.
I move to report.
Second.
Right.
With the substitute.
As with the substitute.
There's been a motion to report the substitute that's properly been seconded. Madam Clerk, if you can please open the roll. Please cast your vote, members of the committee. Okay, we'll close the roll, and this bill, we recommend report with substitute by a vote of 9-0. Thank you. Madam Chair, you have the gavel back.
Thank you. I strongly suggest anyone that was not able to speak or did speak, go to the HOD Speak website. That is where you can continue to put public comment that we do read. And so we welcome you for that. And thank you to all the folks that came. Next week, we will be meeting at 7:30 on Tuesday because we do need to finish our docket prior to crossover. At this time, I will entertain a motion to adjourn. It's been moved and properly seconded that we would adjourn. All those in favor say aye. Any opposed? We are adjourned.